Okay, so what we're going to cover is, first, we're going to talk about an integrative approach to disease versus, and look at disease versus health balance. We're going to talk about stress in our autonomic nervous system. And with that, we're going to talk about why it's better to be in parasympathetic most of the time. We're going to talk about how stellate ganglion blocks work, and we're going to talk about indications for stellate ganglion blocks, what to expect after, and then we're going to talk a little bit about synergy between stellate ganglion blocks and ketamine. Now, first of all, to start, I would like y'all to picture a time when you felt really stressed, and picture that time and feel it in your body. You might want to close your eyes for that. And then you can write what you're feeling in your body in the chat box. And M is helping us do this webinar, is on the back side of things, and is going to be reading the chat, and we'll be reading some of the responses that we get. And M, you can just read them as they come up.
Sure, we've got some good ones. Heart beating faster, head hurts, tightness in my chest, nauseous, anger, lump in my throat, lightheaded, palpitations, fear.
Yeah, these are great. And I think this is kind of what we all feel a lot when we are feeling stressed. So I don't want you to all feel stressed for this whole presentation. So let's take a minute to quiet ourselves. And what I'd like everyone to do is just close your eyes, and I'm going to play some calming music here. And then I'm going to read a little guided meditation here while you're listening to this. Take some time to quiet yourselves. And let's take a few moments to remember what our bodies are doing. So first, find a position that's comfortable, ideally with your spine straight. And I'm going to share some brief statements, and I'll invite you to take them in and use them as an opportunity to do some noticing. And use this time to focus your awareness. Feel your hair touching your head. Feel your belly rising and falling as you breathe. Feel the space between your eyes. Feel the distance between your ears. Feel your breath touching the back of your eyes while you inhale. Notice your arms touching your body. Feel the bottoms of your feet. Imagine a beautiful day at the beach. Notice the position of the tongue in your mouth. Feel how one arm is more relaxed than the other. Notice any tightness in your left side of your body. Imagine what it would feel like to float on a cloud. Imagine what it would feel like to be stuck in molasses. Imagine floating in warm water. Feel your face getting soft. Imagine a beautiful flower. As we close out, I invite you to simply notice your breathing. Notice how your body continues to do what it needs to do. And now I'd love everyone to write in the chat box how you feel in your body after going through that little guided meditation. And M, if you could share what responses you're getting, that would be great.
Great, yeah, we've got a few reactions here. Shoulders relaxed, lighter, sleepy, free, relaxed, more space, content, hopeful, patient, and chill.
Great. So that's really simple, just little exercise there. It shows the difference between our body feeling stressed and our body feeling more relaxed. Before we jump into specific talks about stellate, I'd like to talk about what an integrative approach is and talk about the disease versus health balance. So we've talked about this before, but I just want to make sure that everyone understands this. So integrative medicine encompasses all forms of healing modalities with evidence. So under the umbrella of integrative medicine is functional medicine, naturopathic medicine, regenerative medicine, conventional medicine, energy healing, craniosacral therapy, any type of healing modality that has evidence. And I want to make sure that everyone understands that it is evidence-based. So everything that we're doing is evidence-based. And then let's take a 35,000-foot view of disease versus health. So I think of disease versus health as a balance of how robust our biologic systems are versus all of the internal and external stressors that our body has to handle. And so if you look at the seesaw here, if our biologic systems are more robust than the internal and external stressors that our body has to deal with, then we're healthy and we don't have any problems. If we look at the different stressors here, we've got all sorts of things, including infections, toxins, allergies. Stress certainly would go in there. And then our biologic systems are all of our systems that we think of: detox, immune system, adrenal, liver, et cetera. If our stressors outweigh our biologic systems, then we end up having symptoms and we end up having what we call in conventional medicine disease. We don't feel good. So let's zoom in a little bit. What are the things that are going to help our biologic systems to be stronger? So I think the 4 pillars that I like to think about are nutrition and gut health, sleep, which we talked about last month, exercise, and then stress, which we're talking about today. So let's now talk about why stress is so important. Let's talk specifically about why it's better to be in parasympathetic most of the time. So let's think about our autonomic nervous system here for a minute. So we've got our parasympathetic nervous system on one side and our sympathetic on the other side. And this is just a diagram showing for a bunch of different systems in the body, how the parasympathetic and how the sympathetic actually control what's going to happen in our body. So a couple things that I'm sure all of you have noticed is if you're nervous, your mouth is going to get dry. And that's because literally the nerves in your sympathetic nervous system are actually inhibiting salivation. The opposite, if you're in the rest and digest parasympathetic, you're about to eat, you're going to salivate. So that's one reason why, like, we don't want to be eating, for example, when we're in sympathetic, because we're not producing all those initial enzymes in our mouth. That's just a very small example. And our sympathetic nervous system has served us really well. We're all alive now because our ancestors were really good at outrunning saber-toothed tigers. And that's great. That's why we're alive now. And we can thank our sympathetic nervous system for doing its job. And we need our sympathetic nervous system. But what's happened, particularly over the past couple of years with COVID, is that most of us live in flight fight most of the time. And that's really a really hard place to heal and feel well. If you think about, how would you like to feel? Would you like to feel like the person on the right here who's running away from something, or the person on the left who's hanging out in the hammock? So most of the time we want to be more relaxed in our bodies and not running away. Certainly, if you're in a situation where you need to run away, you want your sympathetic nervous system to work, but you also don't want to tire it out by using it all the time. Parasympathetic is kind of the rest and digest, like the puppy resting there, and then sympathetic is the flight and fight. And so I think if you take nothing else away from this talk, the more that we're in parasympathetic, the more our body is going to be able to heal, and the more our body is going to be able to produce the hormones that it needs, the more it's going to be able to digest food and get our nutrients in. So that's where health lies, is being in parasympathetic as much as possible. This is just another visual of parasympathetic versus sympathetic. So when we're in sympathetic, we feel anxious, our blood pressure is high, we feel tired, we feel depressed, we feel irritable, our muscles feel tight. And then, as we just noticed at the beginning, those are some of the similar words what we heard when people were saying what they felt when they thought about something that made them feel anxious or a stressful event. And conversely, when we do meditation, when we do things to calm down our nervous system, we feel way better. One more visual here, sympathetic versus parasympathetic. So sympathetic, our pupils are going to be big, our heart's beating really fast. Our lungs are going to increase oxygen intake so that we can run away. Our stomach is going to contract so we can't digest food. So again, we need the sympathetic, and it's helpful, of course, but we want to be in parasympathetic more of the time. And then just one more visual here looking at parasympathetic versus sympathetic and how it is actually at each individual level in the glands impacting what's happening. So you can look down to, for example, bladder, and you can see that the sympathetic nervous system is actually going to stimulate the bladder. So if you feel like you're peeing all the time, that could actually be your sympathetic nervous system that's contributing there. Okay, so now we're going to talk about how stellate ganglion blocks work and how they fit into this whole picture of parasympathetic versus sympathetic. So think about your computer. You're watching this on a computer or a phone, most likely. When you get that spinning rainbow of death kind of in the picture there, and everything just kind of shuts down. You can't do anything. What's your go-to to get your computer working again? It's to reboot it. When you reboot it, then what happens is you get the computer opening up without all the unnecessary apps, and things work a lot better. So the same kind of idea happens with the stellate ganglion block. When we're stuck in flight fight all the time, we're thinking about the future, we're thinking about the past. It's really hard for us to be present in the moment. When we do a stellate ganglion block, it's like a reboot on that. So it takes away all those concerns of the past and the future, and then we can be more present, and it just feels like you're more focused. It takes away all that extra distracting noise, so to speak. And similar to the computer, if you reboot your computer and then you open up a bunch of apps after, your computer's going to slow down again. So what we do in the office with everything that we're doing is probably only 10% of long-term change. So we do a stellate ganglion block, and it's kind of like rebooting your computer. And then if you open the apps up again in your life, so if you go back to doing all the same stressful things again, it's not going to work as well. So we always like to support people with behavioral changes that are effectively the same as like not opening the apps again. So things like meditation, yoga, gratitude practices, we have lots of ideas. The actual injection, the actual procedure only takes about 5 minutes. And this is a picture of me doing an ultrasound guided stellate ganglion block. So you can see that I have one hand on the ultrasound probe, the other hand on the needle. And then my nurse is helping out with actually withdrawing and injecting. We always use the ultrasound when we're doing it for safety. We can see the vessels, we can see the nerves, you can see exactly where we're going. The first step when we get you into the office is to get a lay of the land. So everyone's anatomy is a little bit different. So we look around for a few minutes to make sure we have the perfect pathway to put the needle in. And then once we have the perfect pathway, then we go ahead and do the injection. And there's a lot of expensive real estate, so to speak, in the neck. So sometimes we'll take 10 minutes to look around to make sure that we find that perfect pathway. But then the actual injection, once the needle is in, it only takes about 5 minutes, probably less than 5 minutes. All right, so how do we upregulate our parasympathetic nervous system? So we're talking about, doing a block is kind of helping to chill out our sympathetic nervous system. Our vagus nerve is the nerve in our that controls our parasympathetic nervous system. It's actually the largest nerve in our body, and it connects our brain, which is our central nervous system, to our enteric nervous system, which is our gut. There's lots of things that we can do to kind of help upregulate our vagus nerve, which is going to upregulate our parasympathetic nervous system. And there's a list here. I'm not going to go through all of them, but basically anything that's going to help your body relax, breathing exercises, gratitude, meditation. This is a nice little diagram, I think, that shows that connection. And we talk a lot about the connection between the gut and the brain. And it's connected via the nerves, but it also affects the microbiome. So important to realize that if we are doing injections and treatments in the central nervous system, like a vagus nerve block or a stellate ganglion block, ketamine treatments, all those things, we also want to always address the microbiome, because if you've been in stress, flight, fight, sympathetic for a long time, that has almost 100% affected your microbiome. So if we just address the brain and we don't address the microbiome at the same time, the microbiome is going to send messages back up to the brain, which is going to cause the brain to be inflamed again and cause you to kind of slip back into those symptoms. And so it's kind of back to the rebooting the computer. We want to also, in addition to minimizing the stressful things that we do and balancing out our nervous system by doing things like meditation, yoga, things like that, we also want to address the gut at the same time. So important that we always think of both of them together. Conversely, if someone comes in and has a bunch of gut problems and we don't address the brain is going to send messages back down to the gut. So we get people that come in that, for example, have had head injuries, and that's causing gut problems. We get people that come in that got food poisoning, that's causing brain problems. So we always want to address both of them. So you might decide that you want to come in to get a stellate block and a vagus block. And pretty much we always block the vagus nerve at the same time. So it's a reboot of your complete autonomic nervous system. If we just do that and we don't address your gut, it's not going to work as well. So you'll probably find that we chat with you about your gut as well. And this is just another diagram. I know I'm showing this over and over again, but I just want to show you that the sympathetic and parasympathetic nervous system affects everything in our body. So the more that we can get our bodies in parasympathetic, the more that we're going to allow ourselves to heal. Which side should we do? So most of the data is on the right side. Most of the data is on vets. Most of the data is on men. So all other things equal, we always start with the right side. However, we always have a chat with you first. If you're someone that has more pain on the left side, we're going to start with the left side. The left-sided vagus nerve has more GI and cardiac innervation. So if you're having more challenges with your gut or something like POTS syndrome post-COVID, we might start with the left side. Right side is more emotional. If you're finding that the main concern that you have is emotional ability, we might start with the right side. And we always have a discussion, decide, and I always recommend that we do both sides. All right, so indications for stellate ganglion blocks. It kind of is going to benefit almost anyone along the spectrum. And so if you look at this diagram here on the left, we have people that are suffering from anxiety, depression, maybe feeling like they can't get out of bed in the day. And then on the right side, we have high performing athletes. And then in between, we have all the rest of us, students, people that are doing their day-to-day work. So what it's going to do is it's going to move you along that spectrum, no matter where you are. So if you're a really high performing athlete, it's probably going to help with your concentration and give you that extra edge to maybe go from getting third place to first place. And we treat lots of athletes that notice a big difference with stellate ganglion blocks. If you're on the other side, you're feeling really depressed, you're feeling like it's hard to heal, maybe you have chronic illness, that's going to hopefully bump you up to the middle. So it's beneficial for almost anyone. It's just going to move you along from where you start. All right, what to expect after the block. So the number one word that I hear after people get a stellate ganglion block is that they have a sense of peace. And who wouldn't want a sense of peace? Oftentimes that's pretty immediate. We'll talk a little bit more about the division of what people expect after. 100% of people are going to have a Horner's syndrome after. So this is a picture of me after I got a block, and I've gotten several. I worked in the ER for many years, so I've gotten several myself, and I find it really helps with concentration, sleep, task switching, all of those things. So on the side that is treated, which in this case is my right eye, my pupil is going to be a little bit smaller. I have a droopy eyelid. Sorry, my left eye. I have a droopy eyelid. The white of my eye is red, and it lasts about 2 to 6 hours. There's a bunch of other normal side effects that are going to happen for 2 to 6 hours after you get the block. And if you're interested in learning more, we have a separate video that's just on the patient experience that goes through all that. How do you know if it worked? So about a third of people have a really profound experience in the office. That might be releasing a lot of tears. It might be a lot of laughter. It might be a really profound memory. I've had people have, someone who has lost someone in a military mission have a really vivid memory of that person. So whatever comes up, it's a very safe place. Whatever comes up, your body is ready and your mind is ready to release it. About a third of people feel relaxed and they respond differently to stressors, and they notice that. So maybe afterwards you're driving and you'd feel like normally you'd get upset in traffic, and after the stellate, you don't get worked up about it. So you might notice over the next days to weeks that you're not reacting in the same way that you did previously. And then about a third of people don't notice a huge difference themselves, but their friends and family members do. So it might be that I get a block and I don't notice a big difference, but other people are saying, hey, Allison, like, what are you doing? Something seems way different. And And so that's also all these different results are all positive results. In terms of actual statistics, it's about 80 to 85% statistically effective at improving symptoms of PTSD when done on one side. And it's about 85 to 90% when you do both sides. And then it's close to 100% effective when we combine it with ketamine. So that's pretty amazing in terms of statistics. Most mental health treatments that we have in terms of interventions, the statistics are far lower than that. And then people ask about sleep. So the night after your stellate, about a third of people have the best sleep they've ever had in their life. About a third of people don't notice much of a change, and about a third of people will have a fitful sleep. And those are all normal as well. For most people, the sleep does improve over time. And then I always recommend that we schedule the other side pretty soon after the first side. So if you imagine, say that you have 100 units of stress, and say that the first side takes away 50 units, and then the second side takes away 50% of that. So you get down to 25 units. So I recommend that whatever side we do the first side, whatever side we do initially, that you schedule the second side pretty soon after that to get the most benefit. We can't do them both on the same day because of the laryngeal nerve. We need to make sure that the laryngeal nerve stays intact and isn't blocked on both sides. All right. And then the final thing we're going to talk about is stellate ganglion blocks and ketamine synergy. So I'm not going to talk deeply about ketamine here, but ketamine is another treatment that we provide, and ketamine stimulates nerve growth. It stimulates the growth of both the parasympathetic and sympathetic nerves. And because the stellate block is kind of helping to chill out the sympathetic nerves and helping to improve our parasympathetic nerve growth, in theory, the combination of stellates and ketamine really have the potential to stimulate parasympathetic nerve growth. And it does really seem that people that are doing them synergistically get better results than one versus the other alone. Okay, so now just before we finish, just think of a time in your life that you felt really relaxed. Close your eyes for a minute and feel it in your body. And then remember that you can actually give yourself this feeling anytime that you want. And that's really what all these practices of gratitude, mindfulness, meditation come down to, is that your mind is actually controlling a lot of what's happening in your body. And so anytime that you can kind of put yourself in a more relaxed position, it's going to help you to be more in parasympathetic and help your body. After getting treatments like the stellate and the ketamine drips, it'll make it much easier for your body to kind of tip into parasympathetic. Again, I just want to mention any additional info. If you have additional info about what it actually looks like on the day of the procedure, you can go to our YouTube site and watch the video on the stellate patient experience. And then I just like to open it up to questions. Before I open it up to questions, though, our next webinar is going to be on April 1st at 10 a.m. And then I'd love it if you send topics that you'd like to see in the future in upcoming webinars. Any questions, Em?
Yeah, we have a couple questions that have come in. The first one here is just about long haul COVID and wondering if a stellate ganglion block would be effective in treating long haul.
Oh yeah, that's a great question. And actually there was a study that was released recently actually showing efficacy with stellate ganglion blocks in helping long haul COVID symptoms. And I think as we continue to get more data on stellates and various conditions, we're going to find that probably getting stellate ganglion blocks helps with almost all diseases across the board. And the reason is because it helps your body to get into parasympathetic more. It's not that the block actually treats the COVID, it just helps your immune system to work better, because when you're in parasympathetic, your immune system can work better. And almost everything that we're doing is really just helping your body to do what it does well and take away any barriers. So that's a great question.
We've got another one here. Wondering, how long does this reset last?
Oh yeah, that's a great question too. So if your stress is in the past, so say you had childhood trauma and everything is good in your life now, it might just be that you get one block on one side, one block on the other side, and you're good to go for a really long time until potentially you have another stressful event. If you're still in the stressful experience. So for example, a lot of frontline healthcare workers right now, fire, police, military, et cetera, if you're still in that stressful job all the time, you might need to get reboots from time to time. So that's why I've gotten 6 overall. And that was when I was working in the ER frequently. So if you're working in a situation where you're still exposed to stress, or if it's a stressful, if you're a caregiver, for example, taking care of a sick child, a sick parent, and you're still in that stressful experience, you might need to get it more frequently. Good questions. Any others?
Yeah, I think I understand this question. When is it inappropriate to get a stellate ganglion block, or when wouldn't it be effective?
When wouldn't it be effective?
Yeah, or I think this person is asking what types of people shouldn't be getting a stellate ganglion.
Yeah, that's a good question. So probably almost anyone would benefit from a stellate ganglion block, but I think contraindications, if someone's on blood thinners, like if you're on strong blood thinners for blood clot or something like that, we'd probably want to wait until it's safe to decrease it, just because we're doing an injection in the neck. Other things, other conditions where we want to be a little careful. Anyone who is really young. So the youngest I've done is a 12-year-old. Potentially we could do younger people, but we'd want to be just careful in terms of them being able to stay still. And then that's, as long as the person can kind of keep their neck in a still position, it's safe. If the person cannot, then we might need to talk about sedation. Good questions.
Great, and I think this is the last question we have time for, but a question about ketamine and stellates, and how does that work? Are they done on the same day? How do those two things fit together?
Yeah, great question. So ideally, I like to not have them on the same day. And the reason is you have to have an empty stomach before you get the ketamine drip. And then oftentimes you can't eat for 2 to 6 hours after the stellate block. And so if you're doing them at the same time, that means that it would be pretty much all day, at like potentially up to 12 hours where you can't eat or drink. And so if people do want to do them on the same day, what I do is kind of schedule the ketamine first and then have people have something to eat or drink and then do the stellate after. It is a lot for the nervous system to integrate. So I think having them separated, like I like to ideally have the ketamine or stellate separated by at least a day in between. So maybe you get a stellate on Monday and then a ketamine on Wednesday, maybe your next stellate on Friday, something like that, just to give your nervous system a little time to integrate and not overwhelm it. These are great questions.
I think that's all the time that we have for questions. So thanks so much to everyone who joined us today, and we'll look forward to seeing you next month. Thank you, Dr. Mulcahy.
Thanks, everyone.